Hour 2 of Late Night Health continues. I'm Mark Alyn. During this hour, we'll spend some time with our friend Barbara Valentine from the 50 Plus Report. We're going to start the hour by speaking with sigrid-fry-revere, who has a PhD and is also an attorney, both from Georgetown, if I'm not mistaken. And when I talked to her on the phone last week, she was actually outside mowing her grass in Virginia. Did I get any of that right, Sigrid?
Yes, that was all correct.
Your doctorate is in bioethics?
Yes, it is.
Wow. What is bioethics?
Well, bioethics essentially is patient care ethics. Medical ethics is what doctors should do, and patient care ethics focuses more on advocating for what patients want.
So if a patient waits for 45 minutes at a dermatologist's office, because...
Yeah, that could be. I mean, the most traditional cases that bioethicists deal with are things like end-of-life decision-making, handicapped infants, organ donation. So it's like the big decisions in life where doctors and patients or family members could disagree.
And you became interested in organ donation. How?
Well, two ways. 30 years ago, when the issue of organ donation, living organ donation, and donating organs from deceased patients became a real possibility for solving the organ shortage because of immunosuppressant drugs. My mentor was testifying before Congress about whether or not we should allow a market in organs, and he and many people said no, and because they felt we could solve the problem with organs from recently deceased patients. That's one reason, and then...
and by market, you mean...
Well,
in the butcher shop,
buying
and selling a kidney.
Yes. In most cases, it was kidneys, yes. I mean, nowadays, we can do living donation with almost everything, but kidneys are really the only thing that people sell. That, sometimes corneas, but that would be from deceased patients.
Because a cornea can be replaced with a piece of glass, a lens.
Well...
can it?
Well... Yes and no. I mean, I think the corneas are still highly from deceased patients are still the way most people, I think, would prefer to go. But I don't know too many details about corneas. Like I usually deal with kidneys and livers. And then shortly after that, actually, my 10-month-old son had kidney cancer.
Oh my!
He lost a kidney, and I was told that he would probably need a transplant by the time he was a teenager. So I was following the issues very closely for two reasons, professionally and personally.
And your son today?
My son is fine. We've learned that people with just one kidney do just fine, and that they do not end up needing to go on dialysis or transplants if obviously, if you get all the cancer and it doesn't spread to the second kidney.
Exactly.
Or if you donate a kidney, which is why it's very important to know, because a third of all our donations are from living donors. Most people don't know that. Most people just think of the little heart sign on their driver's license.
When somebody donates, if I were to donate to one of my sisters, or vice versa, I guess the focus is really on the recipient.
Yes.
A lot of what you focus on is not the recipient, but on the donor.
Absolutely. Because I think, and it harks back to what people were afraid of if we created a market. If we created a market, the problem would be that we would try to get the best deal possible, meaning the donors would get paid little, they wouldn't have follow-up health care, problems that exist in the black market. And there was a fear of commodification. Now, the problem with altruistic donation, which is what we have now, and the principle behind that was that you shouldn't pay donors anything. And unfortunately, people have misunderstood that as meaning you can't even pay their costs, donors' costs. And so what we have now is a situation where only the very rich can really afford to be living organ donors, because most of society expects them not to cover their medical costs. Those are covered. But the problem is travel, lodging, who's going to take care of the family, who's going to take care of the house, what about unpaid leave, what about the person who's going to take care of you when you first come back from the hospital. The average cost for those types of things is about $6,000. So in addition to being someone who's an incredibly good Samaritan who wants to help save someone's life, you've got to have $6,000 in the bank to take care of yourself after you donate.
Wow. What about drugs and other therapies for that person? I mean, having surgery, pain meds come to my mind because I'm a wuss.
And it's very interesting that because someone who needs a transplant has been suffering so long on dialysis and their functioning has been low, that they usually feel great after the transplant because some of their functions being restored to normal, while the poor donor has just given something up. Their body has to readjust. It's been injured. A healthy body has been injured, and it has to readjust, return to a healthy state. And so often the donors are in more pain than the recipients. But all the pain meds and medical costs will be covered, usually by Medicare, because Medicare is the biggest provider of insurance for kidney problems. So usually they're paying for the transplant, they're paying for the dialysis. But whether it's Medicare or the insurance, it's going to be the recipient's insurance, so the person who gets the transplant and their hospital. That's going to cover all the medical costs for the donor. But it's these other things, the incidentals people don't think of. How many people, have $6,000 in the bank and are willing to spend that money in order to do a good deed? And clearly, if it's their own child or their mother or somebody very close, people will risk what a lot of people risk, is losing their house because they can't pay their mortgage, or they get thrown out because they can't pay their rent. But if it's a more distant relative of a friend, a lot of people say no. And that's where I come in. I'm trying to get, through our charity, we're trying to get money for donors and support systems, volunteers, and things like that to help donors make it easier for them to give once they've made up their mind to do so.
Our guest is Sigrid-fry-revere. She is Dr. Revere. She is Dr. Revere, if you really, because she's got a Juris Doctorate as well. She has been an advocate for years, and I guess last year did a TED Talk. So we have, one of the leading bioethicists in the country visiting us today on Late Night Health. What can people do in advance, or should people do in advance, if they're going to make a living organ donation?
That's really an excellent question. It's actually the thing all of us should do, namely be healthy. That's the most important criteria, because they will not take an unhealthy person to be a donor. And that's one reason sometimes it's hard for people to get relatives, because things like diabetes and hypertension, which cause a person to have kidney failure, runs in families. And so sometimes a relative can't donate. Or there's polycystic kidney disease, which runs in families too. So sometimes you can't have a family member. But if you really want to donate, and you have a loved one or a friend, or even, some people are so altruistic that, they want to donate even if they don't get to meet the person. And you can do that by registering with the transplant center. But the things that you would need to do is just do your homework, do your research, find out what your benefits are, from your employer. I mean, we helped one donor who had been told she doesn't have any benefits. Once she explained to her employer what she was doing, her employer said, this is really a great thing. I think we're going to pay you a month of salary in order to do this because we think this is a worthwhile cause. So,
what a great employer.
Right. Yeah, it is a great employer.
That really is. And at the same time, we still have a major shortage of organs, do we not?
Yes. Well, actually, close to one person dies every hour in the United States for lack of a transplant, and 84% of those people need kidneys.
Wow. We're gonna take a time out. We're going to take a time out, and when we come back, we'll continue this. Let's talk about this shortage of organs, especially kidneys, and see what we as the American people can do to provide those organs either after we've passed, if we're healthy, or if we're living and we're healthy. Our guest is Sigrid-fry-revere, and we are talking about living organ donors. I'm Mark Alyn. This is Late Night Health. Don't go away. More coming up. Visit us at latenighthealth.com, and if you go to S under the guest tab, you'll see more about Sigrid and her nonprofit. We'll talk about that coming up as well. Don't go away. More coming up.